you for watching this episode of Making the Most of Primary Sense. There is a new report recently released in the Primary Sense called Winter Wellness. This report shows patients who may be vulnerable to seasonal respiratory infections. To open this report, simply click on the Primary Sense desktop app, click on Reports. This screen here will load, then double-click on Winter Wellness. The report then will automatically launch. Which patients are included in this report? Patients included in this report have at least one recorded consultation or have been prescribed medication within 12 months of the date of this report. Vulnerable patients are those who are generally older with multimorbidity, frailty, or certain diseases. Conditions are identified by diagnosis and/or medications used to treat the condition. Patients of higher complexity, as calculated by ACG Johns Hopkins tool, scores are also included in this report. Please see the link below in the video description where I talk about the ACG Johns Hopkins tool in further detail. Or you can click on this blue tab here, which will give you information on the ACG patient complexity levels. The name of the report first features here, then the date the report was downloaded. This report is showing vulnerable patients 5 to 59 years or Aboriginal and Torres Strait Islander patients 5 to 59 years who may be eligible for seasonal vaccinations. If we scroll down, by default, Primary Sense will show you 25 patients per page. I like to click here and always say, show me all the patients on this page. Then that way you'll see all the patients on this one page. If we go left to right, first we have the remove function where you can remove a patient from appearing in this report for the next 12 months by clicking on the remove button. We then have the ACG core, the patient name, patient phone number, when the patient last visited the practice, existing appointment. This will show me if a patient is booked in to visit the practice again. It will populate with that date. The name of the GP the patient sees, age of the patient, Indigenous status indicated by yes or no, frailty flag as calculated by ACG. Here we have people with a diagnosis or a medication indicating diabetes, cancer, heart disease, respiratory disease, chronic inflammation, or hypertension. Here we have last EDS. This is electric discharge summary where received from the hospital. We then have last flu vaccination. Please note that the flu vax is only shown if it was given in the past 15 months and recorded in the clinical software at the practice. Next, we have the pneumovax vaccine. This is the date last given and recorded in the clinical software. We now have the COVID vaccine count. This is the count of COVID vaccinations where recorded in the clinical software. Last COVID vaccination. This is the COVID vaccination last recorded in the clinical system. And finally, we have last COVID infection. This is the date of the last COVID infection recorded in the clinical system. As always, when looking at vaccinations, please always check the Australian Immunisation Register if vaccinations have been done elsewhere and update to the clinical software. In Primary Sense, you can click on any of these headers to sort. So if I wanted to sort my patients with ACG score the highest, I would click here once and once again. Now it's sorting from highest to lowest. If I wanted to sort of patients who have not received a flu vaccination in the last 15 months, I would select here once. It would show me all the patients, their last dates. Click again. All those patients without a flu vaccination recorded any clinical software. And as always, you can export any of these reports to Excel or CSV by simply clicking on the option. Here is one I prepared earlier in Excel format. This data here is exactly what you were previously seeing in this report here. You can complete some basic filtering in Excel by clicking on row 1, selecting data, and clicking filter once. Now I can search for all my patients by clicking here, last flu-vax. Show me patients with nil, so no flu-vax recorded. And here they all are here. If you have any questions on this report or using Primary Sense, please reach out to your local primary health network.